Hi everyone and welcome back to my channel. So in this video, I'm going to be covering infectious diseases that impact the nervous system. What I like to do at the beginning of these videos is just remind everybody of the anatomy of the organ system or body system that we're going to be talking about. So just as a reminder, we have the central nervous system that includes the brain and the spinal cord, and then we have the peripheral nervous system that includes the nerves that innervate the remainder of the body. And within the central nervous system, we'll be talking a good deal about different types of meningitis. So we'll talk about bacterial, viral, and fungal meningitis during this video. So let's just remind ourselves of what the meninges look like. This is that protective covering that protects the brain tissue. And obviously, anything that can get in there and cause damage is going to be highly problematic and potentially fatal. So let's begin our conversation with bacterial diseases of the nervous system and start with bacterial meningitis. So there are four common species of bacteria that cause meningitis, but this is by no means an exhaustive list. I'm focusing just on the four that we are most likely to encounter in a clinical setting. So the first and foremost is Neisseria meningitidis. This is also sometimes referred to as meningococcus. This is a gram-negative diplococcus, and we can contrast that with Streptococcus pneumoniae, which is a gram-positive diplococcus. Now, Haemophilus influenzae, a gram-negative rod, can also cause meningitis. And then in neonatal cases, often it's Streptococcus agalactiae, which is a gram-positive streptococcus. This is one of the reasons why pregnant women are often screened to find out whether or not they have Streptococcus agalactiae in that particular part of the body where birth is going to take place prior to them giving birth. And if it is detected, they will go on antibiotics because there is this risk that it could be passed through vertical transmission to the baby. You can see here, this is what a normal brain looks like. And this is what the brain of a patient who died from meningitis looks like. So you can see, the hemorrhaging and the bleeding and how much damage is actually done as a result of bacterial meningitis. So, meningitis has common signs and symptoms regardless of what the causative agent is. Severe headache is very common. High fever is also very common. Photophobia is a big one. This is usually due to the headache. But the real big one is what we call nuchal rigidity, which is a stiff neck. A very quick test you can do to see if meningitis is something that might be possibly affecting your patients. Can they do this? Can they drop their chin and have it touch their chest? And if they can't because of pain or stiffness in the back of their neck, that's usually a pretty good indication, sort of a very sort of cursory sign that meningitis might be something that's impacting your patient. There may also be petechial rashes on the skin or the mucous membranes, although this is most commonly found in patients with meningococcal meningitis, so Neisseria meningitidis as the causative agent. For the first three that we mentioned, so Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenzae, these are typically transmitted via respiratory droplets and aerosols. So this is a contagious disease. So it's not something that you're going to want to be exposed to. If you think your patient has meningitis, you should be wearing proper PPE to protect from that transfer to your body. In the case of Streptococcus agalactiae, as I mentioned before, this is usually the result of vertical transfer through childbirth. The way to diagnose this is to do a lumbar puncture, which is also known as a spinal tap. Basically, you put a fairly large needle into um, the spinal column and pull out the fluid inside, and that CSF will contain the bacterium that is causing the infection. And we'll learn later on that it could also be a fungus. And in the cases of viral meningitis, it's also sometimes referred to as aseptic meningitis because you're not going to find anything, even though you have all the signs and symptoms of meningitis. So there are vaccines that can help prevent this. There's a meningococcal vaccine against Neisseria meningitidis. The pneumococcal vaccine should protect against Streptococcus pneumoniae. And then the Haemophilus influenza B or Hib vaccine protects against Haemophilus influenzae-based meningitis. So that can reduce the chances of somebody getting it, but it doesn't absolutely preclude that. And then for Streptococcus agalactiae, prophylactic antibiotic therapy. So, if mom is shown to have Streptococcus agalactiae, particularly near the vaginal opening or in her body, that's something that we're going to want to treat mom for to rid the body of that prior to the birthing process. Treatment, of course, is antibiotics. This is not something you're going to want to wait around to find out what the actual causative agent is. In fact, it's usually good protocol to treat all cases of potential meningitis as bacterial meningitis until proven otherwise. So if your patient comes in, they're exhibiting signs and symptoms of meningitis, you put them on broad spectrum antibiotics, and then it later comes back that, well, actually, it's viral meningitis, then you can just pull them off the antibiotics. But if you wait to get confirmation that it is, in fact, bacterial meningitis, it might be too late because this can be fatal. So treat with antibiotics and then adjust accordingly once you get the results back. So complications, when it comes to meningococcal meningitis, there's a decent chance of death if left untreated. Irreversible nerve damage can occur, loss of hearing, brain damage, and even amputation because there can be damage to the peripheral tissues. In terms of Streptococcus pneumoniae based or pneumococcal meningitis, that is again potentially fatal. Obviously, anything that is damaging the meninges can be problematic. Haemophilus influenzae in about 5% of cases can cause death, and that's usually due to increased intracranial pressure. The swelling, the inflammation, that kind of stuff can damage the brain irreversibly and kill the person. In about 20% of cases, deafness, partial or whole, and brain damage occurs. In terms of Streptococcus agalactiae, there's about a 10% fatality rate when it comes to this. And again, we're dealing with newborns who do not have a fully functional immune system and are going to have a very hard time fighting this. And that's, again, why we do that screening to make sure that there's a very low chance of mom passing this on to the baby. It doesn't matter what kind of bacterial meningitis you get if it's left untreated. So those numbers I'm giving you are with treatment. It doesn't matter what type of bacterial meningitis you have. There's a greater than 70% fatality rate if antibiotics are not used at some point. So those numbers that you're seeing are actually like, that's with treatment, right? So without treatment, there's a 7 in 10 chance that you're not going to survive. So that's why we immediately begin treatment with antibiotics. We assume bacterial meningitis and then adjust accordingly. When it comes to viral meningitis, I don't have like a separate slide on that. And the reason why is there are so many different viruses that can cause viral meningitis that it's not worth listing them all. The big thing to understand is this: viral meningitis is significantly more common and less severe than bacterial meningitis. Most people do not die from viral meningitis, and there's not really a treatment for it. I've had people that I know personally, relatives of mine, for example, that have gone to the hospital. They're diagnosed with viral meningitis, and they're basically sent home and said, like, yeah, like it's gonna suck for a while. Like your body's got to fight this off. But in general, you're going to survive it. So if you get to pick what kind of meningitis you have, do viral. While there is no treatment, the disease is usually less severe. The symptoms are less severe, and there's a significantly lesser likelihood that you're going to die of it. So, like I said, most cases resolve spontaneously. In severe cases, you may need to be hospitalized for supportive care until your body's able to fight it off. That doesn't mean that you can't die from viral meningitis. It just means it's significantly more rare than in the case of bacterial meningitis. Okay, so moving on to another bacterial infection that impacts the nervous system, tetanus. So tetanus is caused by a gram-positive endospore-forming rod called Clostridium tetani. It does come in a few different forms, all of which are potentially fatal. So this is definitely something that we just cannot leave untreated. So let's look at some of these different variations. So first off, there's localized tetanus. So the way you acquire this is usually by something traumatic. I know our mind all goes to like, I stepped on a rusty nail, but that's not the only way to get it, but usually it needs to puncture through the skin. We'll learn there's a couple other exceptions to that, but usually it's trauma. So localized tetanus impacts the tissue site near the injury. What you might notice are mild localized spasms. And where you're likely going to get this is if you have not gotten your tetanus booster. The DTaP vaccine or the Tdap vaccine or just the tetanus vaccine that we get at early during our childhood vaccination schedules is usually preventative, but it expires after about 10 years, and they recommend boosters every 5. So if you were to get some sort of traumatic injury like this, it's a good idea to go to the doctor and get a booster if you haven't recently gotten one. There's something called cephalic tetanus. This is usually associated with injuries to the face or the head. So maybe you scrape yourself on a nail or something metallic like that. What you might notice is double vision and eye muscle spasms, and this is because it's damaging the nerves that innervate the eye, and it's going to cause all kinds of symptoms associated with that. And then there is generalized tetanus, and this usually impacts multiple body tissues. So basically, generalized typically starts as localized or cephalic, depending on where the wound site is, and then begins to spread throughout the body. And this is when it starts to get real scary, because this is where you start to see the other name, lockjaw. Lockjaw is the other name for tetanus. Intense muscle spasms, spasming of the larynx and the diaphragm and the chest muscles, and then you develop this rigid, stiff arch posture. There's actually a stereotype progression. Um, and the thing to realize is that this is just extraordinarily painful. This is one of the worst ways imaginable to die, with every muscle in your body essentially contracting all at once and waiting to essentially die um, from the muscles just no longer being able to function appropriately. There's also neonatal tetanus, and this usually occurs through the umbilical stump. Somehow the tetanus spores get into the umbilical stump. You're going to see the same exact signs and symptoms, and in this case, it's somewhere between a 70% and 100% fatal with that. So, um, how do we get this? Like I said, trauma and contact with the endospores. So this needs to find a way to get into your body, and it's usually going to be through a puncture wound or some other type of cut or scrape. Diagnosis, clinical signs and symptoms will do that for you, but you also want to look at the patient's vaccination history. Are they unvaccinated? When was the last time they got a booster? Has it been 10, 20 years since they had a booster? Yeah, then they're probably susceptible. The prevention for this is one of the various vaccines. So DTaP and Tdap are essentially the same thing. It's just whether diphtheria is involved or acellular pertussis. So DTaP is diphtheria, tetanus, and acellular pertussis. The Tdap booster is usually tetanus and acellular pertussis, or you can just get the tetanus vaccination. So it depends on, usually what you get depends on where you're at in your life. Essentially, you're going to start by getting your DTaP vaccine in childhood. Then how are you going to get boosted? All right. Treatments are usually used in combination. So there may be consequences to breathing. So as we talked about, it can begin to paralyze the diaphragm. So you might be put on a ventilator. You're going to need antibiotics to kill off the Clostridium tetani. And then there's going to be the tetanus neurotoxin antitoxin that's going to be delivered. So these are antibodies against the tetanus toxin, which is going to hopefully, sort of soak all that up in the body and allow it to be removed so that you don't die. Complications, if it's not treated, you're probably going to die. And it's a horrible, horrible death. So, before you think like, oh, I don't need all my vaccinations, this one you should probably get unless you want to risk dying of a horrible, horrible death. Another Clostridium species that can cause an infection that impacts the nervous system is Clostridium botulinum, which causes the disease botulism. So the other thing to realize is botulism can be caused by direct injection of the botulinum neurotoxin into a tissue. So there are ads on TV, at least in the United States, for Botox because while it is often used for cosmetic treatments, there are medically relevant uses for botulism, for example, for treating cluster headaches. One of the things you'll note in those commercials is if you have trouble swallowing or difficulty seeing, please contact your physician. Yeah, because now you're exhibiting signs and symptoms of botulism. So it is a gram-positive endospore forming rod, just like we saw with Clostridium tetani. And this is a progressive disease. So early on, blurred vision, drooping eyelids, difficulty swallowing, and then that might lead to abdominal cramps, nausea, vomiting, constipation, diarrhea. So it's sort of descending downward, right? Then later on, you're going to note progressive flaccid paralysis. So in tetanus, you get that rigid sort of like contraction of the muscles, and that's where the paralysis comes in. You just physically can't uncontract the muscles. Just imagine having your entire body being a Charlie horse. Botulism is the opposite. You end up with this flaccid paralysis. You literally, it's like your arms are asleep. Your muscles just do not work, and you gradually begin to become weak and lose muscle control. And this is where it's going to kill you, because it's going to gradually paralyze the muscles that are required for breathing, your diaphragm, your intercostal muscles, things like that. In an infant, if they were to get this, a weak cry, decreased ability to suckle, and then limpness as this begins to happen. This is why with infants, we need to be very, very careful about what we feed them. Honey is a big one. You should not give children under the age of 2 honey, because this seems to be one method in which botulism can make it in through ingestion. So how do we get botulism? Well, there's what we call wound botulism, and this is where Clostridium botulinum enters the body through a wound. Most commonly, it's actually going to be foodborne, so food containing the neurotoxin gets ingested. Things you want to watch out for: improperly canned or preserved food. So, if you look at a can and it's bulging, or you look at a beverage and it's got that pop top, but the top is popped up, that's one of the things it says, right? If the button is no longer depressed, do not consume. That could be a sign that that Clostridium botulinum is present in that sample and growing. The other one is called iatrogenic, and this is when you get it from the botulism neurotoxin. Okay. Diagnosis: clinical signs and symptoms. You can also detect the neurotoxin in blood, stool, or vomit. And then to treat this, often you're going to need ventilation. You're often going to need to breathe for the person, because, again, that descending paralysis is going to begin to lead to the flaccid paralysis of the intercostal muscles and the diaphragm, which is required for breathing. And then you've got to use the botulism antitoxin to soak up all of that neurotoxin in the body, and then flush it out, and then the patient can begin to recover. Complications: death if left untreated. So yeah, you're going to die of this. You're just going to suffocate, because eventually the muscles that are required for you to breathe are going to stop working. Okay, moving on to listeriosis. Listeriosis. So listeriosis is caused by a gram-positive rod called Listeria monocytogenes. The signs and symptoms usually appear to be a case of food poisoning. So you'll start with fever, chills, headache, upset stomach, nausea, vomiting, and muscle aches. Why are we talking about this in the case of nervous system infections? Well, about 20% of cases in neonates and people over the age of 60 will result in meningitis. So this is one of those things where, in a lot of people, food poisoning, you don't feel well and you get over it. But if it begins to make it into your meninges, if it makes it out of that part of the body, now there's going to be issues. So it's typically foodborne. Where are you getting it from? Raw milk. Again, I think in almost every video I've done in this series, I've said, stop consuming raw milk. It's dangerous. And Listeria is one of these bacteria that can be in there. Fresh and frozen produce, so make sure you're washing that. Processed meats tend to harbor this, and soft cheeses are also a source. So again, keep track of those best by, sell by, use by dates to make sure this isn't problematic. And the one thing I will note to you about this: Listeria monocytogenes is a bacterial species that can grow in your refrigerator. All right, its optimal growth zone ranges from about 4 degrees Celsius to about 40 degrees Celsius. So it is perfectly comfortable living in your refrigerator and growing there. It's not going to be held stagnant. Diagnosis: you'll be able to detect the bacteria in the blood or the cerebral spinal fluid, depending on where the infection is. It just food poisoning, or has it made it into the meninges? Treatment is with antibiotics. In about 16% of cases, people will die, which is obviously the worst complication. And women who are pregnant may end up resulting in a miscarriage. Spontaneous abortion is the technical term for that. We often refer to it as a miscarriage. And for this reason, a lot of women are discouraged from eating things like lunch meat, soft cheeses, and certainly consuming raw milk, because they are potential sources for this particular bacterium. Okay, let's move on to a disease that is incredibly rare, but is something that has really terrified people for the majority of human existence. And this is called Hansen's disease, but it's more commonly referred to as leprosy. The bacterium involved is Mycobacterium leprae, so it's a cousin of Mycobacterium tuberculosis, which we've met in another video. Just like other Mycobacterium species, it is an acid-fast rod. It has that mycolic acid cell wall that's waxy and greasy. And just like we saw with Mycobacterium tuberculosis, this is an incredibly slow growing bacterium because that mycolic acid cell wall makes it hard for it to absorb nutrients. It also protects it from antibiotics, but that means the bacteria grows very slowly, which means this is a very slow progressing disease. So you might not notice any signs or symptoms until years after you've been exposed to this. And even then, what you might notice is very minor, small, blanched, numb patches of skin that may resolve spontaneously. Those may progress into nodules, which eventually lead to nerve damage and numbness. And then you can end up with chronic tissue damage, loss of digits, and body parts. So you may have heard in older times that people that had leprosy were sent to live in leper colonies. They were forced to live amongst each other. There were lots of reasons for this. The damage that can be done can be incredibly the disfigurement can be incredibly grotesque. Plus, people were very worried at the time. There were no antibiotic treatments, and if you did contract leprosy, you just kind of slowly rotted away because there's no way of treating it or preventing it. This bacterium can be inhaled, but prolonged and repeated skin contact can transmit it. And there's actually one other mammal species other than humans that harbor this particular bacterium, and it's armadillos. So if you have a pet armadillo, just be careful, I guess. I don't even know if you're allowed to have a pet armadillo. I don't know. Diagnosis, clinical signs and symptoms, and then a skin smear or a skin biopsy will show that. There's a multi-drug therapy for this that will get rid of it. And it is free worldwide. This is one of the things that the World Health Organization is like, yeah, if you have somebody in your country with leprosy, let us know, because we're pretty close to eradicating this thing. So here are the drugs. Let's treat this. Complications, disfigurement. I think that was the big thing that caused these people to be isolated from society. These people have, if the disease has progressed significantly, it's going to be very obvious that these people are disfigured and they're hard to look at. Death is actually very rare. This is such a slow progressing illness that you're going to die of natural causes probably before it can cause you to die. But obviously, because of the effects on the body, this was a disease that terrified people before we really understood how infectious diseases worked and how to treat them. Okay, so now we're going to move on to acellular diseases of the nervous system. So we'll talk about viruses. We'll also talk about prions in a little bit in this section. So the first thing we'll talk about are collectively referred to as arboviral encephalitises. So you'll see these here. There are 5 that I'm listing. The Eastern equine encephalitis virus, also known as triple E. This is actually something that, so I'm recording this in the fall of 2024. Over the summer of 2024, there were a series of Eastern equine encephalitis cases in New England and the upper Atlantic coast region of the United States that were killing people. So this is something that is kind of fresh in the minds of a lot of us right now as I'm recording this video. There's also Western equine encephalitis virus, St. Louis encephalitis virus, Japanese encephalitis virus, and West Nile encephalitis virus. All 5 of these are mosquito delivered viruses that cause encephalitis or inflammation of the brain tissue. Signs and symptoms. In most cases, the signs and symptoms are either very mild or the person is completely asymptomatic. If a person is immunocompetent, this is usually a good for them. This isn't going to be something that's going to kill you. It's kind of why these Eastern equine encephalitis virus cases this summer were a little bit scary. It's not that we don't see triple E often, it's that we don't usually see triple E being so virulent that it can kill people. Signs and symptoms: high fever, chills, headache, vomiting, diarrhea, and restlessness. In the severe cases, convulsions, coma, and death. We most often see this in elderly individuals who have been infected by these viruses. All right. These are all transmitted by mosquitoes. That's why they're called arboviral. So they're going to be spread by whatever local mosquito species are around in the region where these viruses are endemic. So in the case of triple E and WEE, Eastern equine, Western equine encephalitis, the transmission is from horses to humans. When it comes to St. Louis and West Nile, this is birds to humans. And then in Japanese encephalitis, we are looking at transmission from birds or pigs to humans. So either horses, birds, or pigs provide the reservoir. Mosquito bites one of them and then goes on to bite a human, and that spreads it. All right. Diagnosis is clinical signs and symptoms, although you can do serological tests from the blood and the cerebral spinal fluid to detect the virus or the antibodies that are made in response to the virus. In the case of Japanese encephalitis virus, there's actually a vaccine that can prevent that. Treatment is supportive care. Now, there are complications that include death. So, in the case of Eastern equine encephalitis, this is the one of the worst of the bunch. About 1 in 3 people will die, and survivors will often have some type of permanent brain damage. In the case of Western equine, it's 3 to 4%. For St. Louis, it's 5 to 15%. For West Nile, it's around 25%, although 30 to 50% of survivors have some type of mental impairment as a result. And then Japanese encephalitis, about 1% of patients will actually develop the encephalitis, and if they do, 10% of those cases are fatal. So these are not trivial infections. And the one thing I will note, for example, in the case of Eastern equine, there may be a lot of underreporting in a lot of these. As I mentioned, for many of these viruses, a lot of the diseases can be asymptomatic. Why does that matter? Well, that matters because if you don't develop signs and symptoms, you're not going to seek treatment. So there's a decent chance that that number is lower because we're really only seeing cases where people develop the signs and symptoms of the virus. Okay. Zika virus. So Zika virus was a big thing in the United States in the last few years of the 2010s. We started to see this making its way into the United States, and it was terrifying for a lot of people. And the reason why is some of the complications associated with it are pretty bad. So it is caused by the Zika virus. It is spread by mosquitoes. The signs and symptoms include fever, skin rashes, conjunctivitis, muscle and joint pain, malaise, and headache. This can usually be diagnosed by clinical signs and symptoms, although there are some confirmatory tests, including a viral RNA test, RT-PCR, and ELISA. The treatment is for supportive care. There really are no antivirals that are effective against this. Now, what we're predominantly concerned with isn't the average person getting Zika, because the average person is most likely to be fine. The problem is pregnant women becoming infected with the virus. And the reason why is if the fetus gets infected, the baby could be born with microcephaly and brain damage. So this is what was really scaring people, is making sure that women couldn't get infected with it. There was also concerns that men could be infected with it, and then during the process of fertilization that they could transmit the virus to the woman. And then now she has it, and that could impact the fetus. So there's a real scare, not about necessarily the individuals themselves who get infected, but what could happen if while infected, or at least while the virus is present in the body, getting someone or becoming pregnant, because that can then result in problems with the developing fetus. Another viral disease that infects the nervous system is rabies. So the rabies virus is typically spread by the bite of an infected mammal. Those mammals do vary regionally within the part of the world that you're in. So even within the United States is different. I live over on the East Coast. We tend to think about rabid raccoons over here. Bats are also a big concern. If you head out west in the United States, it's usually rabid coyotes and bats that are a problem. It could also be foxes and bats that are a problem. So the reservoirs vary depending where you are on the world. Signs and symptoms, early on, discomfort around the bite, fever, and headache. Then later on, there are two different sort of classifications. There's what's called furious rabies or paralytic rabies. So in furious rabies, this is where you get the hydrophobia, fear of water. They become hyperactive, agitated, they drool, and they have a desire to bite people. And that's because the virus damages the brain, and it's spread through bites. So it It literally like makes you want to bite people so that the virus can be spread. There's also the paralytic version of this, which is a slow spreading paralysis that leads to coma and death. The one thing to note is this: if you believe that you've been exposed to rabies, or you have any reason to believe you've been exposed to rabies, maybe you were bit by a strange dog, maybe you were bit by a wild animal and then it ran away, you need to get treatment immediately, because once these signs and symptoms begin to show up, rabies is almost always fatal. Always fatal. And again, another horrible death associated with this virus. So, diagnosis: RT-PCR of the saliva from the bite wound or of the patient. Immunofluorescence tests on the bite site can also give some indication. Usually, they want the animal itself so they can test it. The animal will have to be killed in order for that to happen. Um, but in many cases, there is no animal to test. So if they believe that you've been infected, you're going to go get the rabies vaccine and anti-rabies IgG. It's a series of shots. It used to be like these when I was a kid, like rabies vaccines were no joke. You get like 4 large bore needle injections in your abdomen, and it was supposed to be incredibly painful. Fortunately, I never had to have that done. Um, but in this case, the vaccine can actually be given as a treatment because it takes a while for the virus to spread and develop. So if you get bit by a wild animal, immediately seek medical attention, get the vaccination, get the IgG. That will prevent rabies from forming. Because like I said, by the time you start to develop these signs and symptoms, you're pretty much dead. There's really not much that's going to be done to treat this. Complications, always fatal once late symptoms appear. I will note that there is a rabies vaccine that can be given to humans. I know we all try to get our pets vaccinated against rabies, like dogs, cats, things like that, but there is one for humans. But because most humans don't need to worry about this, we don't usually give it prophylactically because it does work after exposure. But people who are like vet techs, veterinarians, people who work with animal control officers, they will actually get the rabies vaccine prophylactically in many cases because they actually have an increased chance of being bitten by an animal that could have rabies. The average Joe Schmo off the street, uh, it's very unlikely that we're just going to get bitten by a rabid fox or a bat. It's just unlikely to happen. Okay. The next one is poliomyelitis. Now, I want to be careful how we talk about this. So, the first thing to realize is the polio virus is not what a lot of people think it is. The polio virus is usually delivered through either respiratory aerosol or droplets or through the fecal oral route. And in 98% of cases, people who contract the polio virus will either be asymptomatic or experience a stomach bug, diarrhea, vomiting, nausea, that whole thing. But in 2% of cases, okay, in 2% of cases, some type of paralysis will develop. And that's because the polio virus has the ability, in some cases, to leave the intestine, leave the GI tract, and then make it into the nervous system and damage the neurons that innervate the skeletal muscles or any muscles. And when those neurons are impacted by the virus, they can no longer function. And now that person does not have control over those muscles anymore. In some cases, that can lead to paralysis, like we saw with the former president, Franklin Delano Roosevelt, where his legs were impacted the most. But in other cases, it can impact the muscles that are responsible for breathing. And as you can see here, this is a patient that's been put in something called an iron lung, and they will need to remain there for the majority of their lives. Fortunately, there are vaccines against this. So there are two different, there's the Salk polio vaccine and the Sabin polio vaccine. They differ. The Salk vaccine is an inactivated virus vaccine. The Sabin, I believe, uses an attenuated virus platform to do that. But both of them are effective at preventing polio. This is still a vaccine that we all get as part of our childhood vaccination schedules. Although I will note that it is a bit scary that in some of the major cities in the United States, New York, for example, they have detected polio virus in the sanitation system, which means there are people carrying live polio virus, which is scary. And again, kind of attests to how far the anti-vax movement has gone. This is a vaccine that's been given since 1955. It's incredibly safe and life-altering. We don't see people in iron lungs anymore. If a person does contract poliomyelitis, supportive care, you're going to need to do what you can until the virus passes through, and then you're going to have to deal with the sequelae, those things left after. And that may include a lifetime spent on a breathing machine simply because those muscles are damaged beyond repair. Complications, permanent paralysis. Typically, whatever gets damaged during the infection remains damaged for the rest of the person's life. And again, if breathing is impaired, it could be fatal to that person, or they have to spend the rest of their life in some type of breathing machine. The last of the acellular diseases that impact the nervous system is are spongiform encephalopathies. So there are a lot of these. You've probably heard of them. Mad cow disease, scrapie, that kind of thing. In humans, there are two diseases: Creutzfeldt-Jakob disease and Kuru. And these are actually caused by a malformed protein that in humans is referred to as PRP. Signs and symptoms include memory loss, personality changes, blurred vision, uncoordinated movements, and insomnia. The thing to realize is this is a disease that can take decades to manifest. You might not notice anything until decades after you've been exposed. And typically, this is the result of exposure to and consumption of infected nervous tissue. The only way to diagnose this is via a brain biopsy, and typically that's not happening until the person is dead. And what you can see here is this is what normal brain tissue looks like, and you can see the holes. This is Kuru. This is actually the result of humans eating other humans. It's found in a very select population of indigenous peoples who have like a ritualistic practice of eating their dead. And this spreads, but this is what you would see in Creutzfeldt-Jakob disease if somebody were to have acquired this from being exposed to or consuming the infected nervous tissue of, for example, a sheep or a cow or whatever. Treatment is supportive care, but unfortunately, this is 100% fatal. The damage that happens to the brain is irreversible. So this is something that is an incredibly scary illness. Fortunately, it is exceedingly rare. But there is really nothing that can be done once it has been acquired. Essentially, what happens is this malformed protein goes on to interact with other proteins, and it can begin to accumulate and damage the nervous tissues, and those cells die, and that's where you get these holes in the tissue from, is just like massive amounts of cell death in the brain. All right, so we'll finish off this presentation with fungal and parasitic diseases of the nervous system. The first one we'll talk about is cryptococcal meningitis. So Cryptococcus neoformans is a yeast. It's a fungus. And it can cause meningitis, but that's not common in people who have a fully functional immune system. So most infections with Cryptococcus neoformans result in subclinical respiratory infections. You get a cough and then your body resolves the issue on its own. However, in immunocompromised individuals, it may disseminate to the brain, and signs and symptoms are going to be similar to other forms of meningitis. So, the photophobia, the nuchal rigidity, all that kind of stuff. This happens in about 85% of cases where people are exposed to this and have AIDS. Transmission is inhalation of the spores. These are often associated with pigeon droppings, but I would be cautious around any group of birds because they can kind of harbor that, and then the feces can be the spores can grow in the feces, and then you can inhale them. Diagnosis: there will be you can usually detect this in the urine of a patient that has it, and then this is what it's going to look like when you do that. Treatment is with antifungal therapies. This can last up to 10 weeks. And in people who are immunocompromised for one reason or another, again, it could be AIDS, it could be someone that has, one of those primary hyposensitivities that I've talked about in other videos. This can become a chronic infection, and they just kind of have to live with this in their body and hope that it doesn't spread and get worse over time. It's almost a bit like having cancer, where it's there, you want to keep it in check, and then hopefully it doesn't spread and cause more issues. There's also something called amoebic meningitis, which is caused by an amoeba called Naegleria fowleri. You may also know this as the brain-eating amoeba. This has gotten more and more prominent, at least in the United States, over the last decade or so. One of the reasons for this, believe it or not, is actually climate change. This does prefer warmer bodies of fresh water, and as the heat wave has sort of progressed more and more north, we're starting to see cases in bodies of water where we didn't used to. I'll give an example: Minnesota. It's been found in Minnesota, where we don't believe it used to live, because those lakes are staying warmer for longer. Uh, Signs and symptoms early on: severe headaches and fever, and then later on seizures, coma, and death. This is almost always fatal, as you can see down here. In the United States, we've had 138 documented cases. All but 3 of those individuals died as a result of the infection. When you do the lumbar puncture, you're going to see these amoebas in there. You can also use immunofluorescence or PCR to confirm. There is a treatment using an antiparasitic called miltefosine, and then therapeutic hypothermia. They literally cool the body down, which I believe slows down the reproduction of the amoeba and renders it more susceptible to the miltefosine. But as you can see, even this hasn't shown to be remarkably helpful. There's another kind of amoebic meningitis called granulomatous amoebic meningitis. This can be caused by either Acanthamoeba species and Balamuthia species. So we met Acanthamoeba in the video I did about diseases of the skin and eyes. Acanthamoeba is this thing that can live in fresh water. It's one of the reasons why you don't want to wash your contacts in fresh water. They can get mashed between your eye and the contact lens, and it can start to damage the eye and cause amoebic keratitis. But in some cases, this can actually push further into the head, basically, and get into the brain. So it can enter through the nasal sinuses or through broken skin. And then when you do a CT scan or an MRI of the brain, you'll find the lesions that are in there. Again, miltefosine or antifungals can be used, but again, this is nearly always fatal. Bottom line, don't let amoebas into your brain. And as you can see, these are both through inhalation of the amoeba through freshwater sources. Okay, so just be careful if you're swimming in lakes and stuff like that. Try not to inhale the water. Don't let it into your nasal cavity. I need to stress this though. This doesn't mean you can't swim in lakes. Again, you can go back here. 138 cases documented in the United States. Is it becoming more prevalent? Yeah. Are we at the point where it's like you can't swim in lakes? No. I'm not saying don't swim in lakes and ponds. I'm just saying be careful. And if you start to develop any of these signs and symptoms after having done that, go see a doctor immediately. Okay. Next up is human African trypanosomiasis, which is better known as African sleeping sickness. So this is caused by a species of trypanosome, which is a protozoan, known as Trypanosoma brucei. There are 2 different subspecies, T. brucei rhodesiense, which is in East Africa, and then T. brucei gambiense, which is in West Africa. So again, subtle differences between the parasite, but they're causing the same illness. This is what they look like, by the way, in case you're wondering. And if you're in one of my classes, you've actually had the opportunity to see this on one of the slides that we have. Signs and symptoms. So the first one is called Winterbottom's sign. These are enlarged lymph nodes at the back of the neck. So they're on the back side. There's also usually a chancre at the site of the infection. You're getting this by being bit by the tsetse fly, which you can see here, which is this crazy looking fly. It's actually kind of big and gross too. Then you'll get undulating fever and then possibly septicemia. What's interesting about this is it gets bad and then it goes away. And then like a week later, it'll come back and then go away. And it does this over and over again. And the reason why is it has to do with how the trypanosomes, where they are in the body. Then later on, daytime sleepiness, insomnia, and mental deterioration. So that's where the sleeping sickness part comes in. They tend to reverse cycle, which means they'll want to sleep during the day, be awake at night, and then they're going to gradually start to exhibit things like brain fog and other things. To diagnose this, basically, you're going to get a sample of either the blood, the lymph, or the CSF, and then look for these guys in there. How do we treat this? Well, it depends on where we're at in the disease. So if it's before these neuronal symptoms begin to develop, butamidine and suramin, which are anti-parasitics, essentially are used. After, on the other hand, we're going to be dealing with arsenic or eflornithine. So again, like the one thing to point out is these are really harsh chemicals that we're using to treat this infection. This is not good stuff. But in the absence of treatment, this illness is almost always fatal. So deal with the horrible, horrible death that is associated with it, or deal with the horrible, horrible medications that are used to treat it. Not good. So best thing to do is not get bitten by a tsetse fly, and hopefully you don't get African sleeping sickness. But yeah, this is a pretty pretty gruesome illness if you were to contract it. A couple more to go. One of them is neurotoxoplasmosis. This is caused by a protozoa known as Toxoplasma gondii. So neurotoxoplasmosis in many cases is asymptomatic, although people who have something that renders them immuno incompetent, um, they may develop brain abscesses. You get this by ingesting the oocytes from cat feces or contaminated meat. Now, I know you're thinking, I don't eat cat poop. You don't have to. You can ingest it by like fecal flakes and stuff when you scoop cat litter, and that is why pregnant women are discouraged from changing their cat litter. And the reason why is, while it typically doesn't have an impact on the individual exposed, this is a parasite that can cross the placental membrane and cause birth defects, which include, mental incapacitation, other birth defects, but it can also result in stillbirth or spontaneous abortion, miscarriage. How to diagnose it? MRI or CT scan can find the brain lesions in I see individuals that have that. Direct observation in the CSF, so you'll be able to find these cysts, or there's also RT-PCR to look for genetic markers in the body. Treatment is a multi-drug therapy that includes a series of antiparasitics, paramethamine, sulfadiazine, and folinic acid are usually used to rid the body of it. And the last one we'll talk about is neurocysticercosis. So we did talk about this in my presentation on infections of the digestive tract. This is usually a result of a tapeworm, most commonly Taenia solium, which is the pork tapeworm. Basically, what happens is the worms make it into the brain and they develop cysts in the brain. So signs and symptoms include seizures, headaches, nausea, vomiting, confusion, and stiff neck. This is actually the leading cause of adult onset epilepsy in the world, and you get this by eating undercooked pork. That's why it's so important to make sure that your pork makes it up to temperature. Diagnosis: MRI or CT scan to look for the cysts in the brain. That's exactly what we're showing right here. There's also enzyme immunoassays and ELISA, so EIA or ELISA, to detect antigens in the body. Now, again, this will also show that the person just has tapeworms. It doesn't necessarily mean they have neurocysticercosis, so having that CT scan is helpful. Treatment: well, it depends. How many cysts are there? Where are they located? How big are they? So surgery is required in some cases to remove these. There's also anti-helminthic chemotherapy, so just deworming medication to get rid of this. And then usually you're going to have to use steroids as well, because as those cysts begin to die, they're going to leach a bunch of toxins into the brain, and the body's going to mount an inflammatory response against this. So you need to turn that off as well, because that could also be fatal. You get that pronounced inflammatory response. So we have to use this in concert. And then sometimes, as I said, surgery is required. So that wraps it up for our conversation about infections of the nervous system. I hope you learned a lot. Please go in. I have 5 other videos about illnesses or diseases that impact the 5 other body systems. I hope you enjoyed this series, and I hope to see you again on my channel real soon. Thanks.